So I'm going to be talking about seasonal allergies, the causes, natural solutions to those. And we've got your friendly neighborhood pollen. In North Carolina, it is the pine state, so we get covered in yellow pine pollen. Like everything is covered in yellow. It's like a yellow fog. That just is just about done, but we've got still oak, birch, plenty of other trees, grasses, and flowers that are just getting started, just starting to release their pollen. So maybe some people are getting their allergies are getting better, but other people, their allergies are probably starting to get worse now. So it's actually been shown that allergies will, in about 36% of adults, will reduce their work performance. So kind of important to do what you can to not have allergies as severe. It'll also worsen asthma symptoms, children's focus in school, so they're not going to be learning as much. Um, and bad seasonal allergies, they're usually a sign of something else going on in the body. So whether that's a weakened adrenal glands, a weakened or imbalanced immune system, or an issue with the GI system, or it can even be a mix of a couple or all three of that. So most of us know the symptoms of seasonal allergies. Classic symptoms are going to be you're sneezing, you got a runny nose, stuffy nose, itchy nose, watery eyes, itchy eyes, puffy eyes, bloodshot eyes. People have headaches, worse asthma, worse focus. It's going to impact your sleep if you're not breathing well, and then you're not going to be able to sleep as well. So I just discussed work performance at work, at school. You're going to feel more fatigued because if you're not breathing through your nose, you're going to end up feeling more fatigued. You end up with a sore throat if you've got postnasal drip. Some people will get earaches. And so I want to talk about kind of the immune system as a whole initially, go through some definitions as so and you've got five different kinds of antibodies. IgA is going to be so Ig is immunoglobulin. IgA is more so for barrier systems, so your gut, your lungs, your blood-brain barrier. IgE, that's more what we're going to be talking about today, is a more acute, full-blown or a full-blown allergic response. It's something that you usually know you're allergic to. Like if you have anaphylactic shock, if you eat peanuts and your throat swells up, you know you're allergic to that. If you eat shellfish and you get hives or whatever, it's usually things that you know you're allergic to. But that's what they're testing for when they do like a skin prick test to see if you react to something. It's usually a fairly quick response. IgGs are going to be more chronic immune responses. Those have lasted for months or longer. It's what they're testing for in most food sensitivity tests. That's part of the reason why I don't fully trust food sensitivity tests. You'll also get where someone brings in a food sensitivity test and is saying they're allergic to something that they don't even eat. So we'll talk more about that in a bit. IgMs are a more recent immune response that has to be within 3 months or it's presently active or attacking. And then IgD is mainly associated with tartrazine sensitivity, so that's yellow number 5. That is in like Mountain Dew. So Chuck, if your kid's all jacked up on Mountain Dew, probably get that out of his diet. Definitely get the yellow number 5 out. And now you have 4 different types of hypersensitivity reactions. So these are all 4 different types of allergic responses. The main one, at least for seasonal allergies, is that hypersensitivity type 1. That's immediate. That's within, you're going to have a response within 2 hours. So you breathe in pollen, you smell a flower or something, and you start sneezing. That's going to be your type 1. That's IgE mediated. So that's where you've got mast cells releasing histamine and plenty of other cells releasing histamine. And this is where you get seasonal allergies. And there's also perennial allergies. So that's year round. That's like your dog allergies, your cat allergies, dust mites in the house, stuff like that. And then also anaphylactic shock at the extreme side of things. Type 2 is more cytotoxic, so that's going to be leading to cell damage. So that's more commonly IgG and IgM. And then that's typically going to be things like drug reactions. Like if you're allergic to a drug, you're going to more often than not have a type 2 Rh disease. So, and then acute rheumatic fever. So that's after a strep infection that could attack the skin, the joints, the heart. Type 3 is immune complex reaction. So that's those antibodies come in and attach to an allergen and create a complex. That's the antibodies are what's going to signal the body to clean up that allergen or whatever it's attaching to. So it creates this complex, and if the body's not able to deal with that efficiently enough through usually your spleen and your liver, what break those down and get rid of them, then they end up, if you're overloaded with those complexes, they end up being deposited into your skin, your joints, blood vessels, etc. So that's going to be your IgG antibodies, IgM, and IgE. That's where you'll get things like lupus. That's more autoimmune type reactions. So lupus, rheumatoid arthritis, glomerulonephritis, which is affecting your kidneys. And then type 4, that's a more delayed, longer than 12 hours, 48, even up to 48 to 72 hours before you actually get an immune response from it. So this could be something like you touch poison ivy, you don't notice anything for a while, but you wake up and now you have skin rash, your skin's itchy, you have the boils and whatever. That's more so T cells, macrophages, cytokines. So T cells are a big part of your immune system. We'll be talking about those next. Macrophages are the main white blood cell that come in and actually eat whatever it is that's causing the problem. There's a few others that do that, but macrophages are the big ones. And then cytokines are what cause like an inflammatory response to infections, to allergens. So this is, like I said, contact dermatitis, all other drug reactions. And in some part, this reaction can be normal when you're fighting off an infection, but it becomes much worse if there's an imbalance in your immune system with that Th1 and Th2 that we're going to talk about right now. So you got three types of T helper cells. So that's what Th stands for. Th1 is involved in fighting off infections. So whether that's viral, bacterial, fungal, and there are some parasites that will elicit a larger Th1 cell response. And then the other side of the immune system, you have a Th2 response. That's going to be allergic responses. So any allergen, seasonal allergies, any food allergies, and then also heavy metals, toxic substances like pollen, medications, bad fats, vaccines. And then mainly this is where your body will use Th2 to fight off parasites. And stress will also increase your Th2 cells and also inhibits your Th1. So in the immune system, it's really more so a balance between the Th1 and the Th2 side of the immune system. One's going to increase to deal if you get an infection, Th1 is going to increase. If you are exposed to an allergen, Th2 will increase. And typically, your T regulatory cells, Treg, will act as a mediator between the two, so one doesn't get too strong over the other. So if you get too high of Th2, you're going to be allergic to everything, and you're probably not going to respond to many infections that you get. That doesn't mean that you don't have an infection, but it means your body doesn't have the ability to mount a strong enough immune response for you to notice it. Which means when you actually do get sick, it typically will last. These are the people that are allergic to everything, but they don't get sick. But then when they do get sick, it knocks them out for a week or two. So, like Mr. Miyagi said, whole life have balance, everything will be better. So what's the cause of your seasonal allergies? Well, the direct cause, as we know, is pollen, like I was saying, the dust, the air pollution. That's causing your body to have a large histamine response to that, which is then going to cause you to have all those symptoms that we talked about. The other option is you're not clearing histamine out of your body efficiently, and we'll talk about that in a second. And I hinted at this before, the deeper cause of that typically is going to be either your adrenal glands are taxed, they're worn out, you've been running yourself thin and stressing out too much, or you're working too hard, working out too hard even. You could have an imbalanced immune system, or you could have poor gut health, and we're gonna get into all of that. So I kind of want to give you a glimpse into how I look at any kind of health condition, and this will be, for allergies, of course. So this is kind of how I work through stuff in my brain. Um, so you got allergies. Allergies, you're going to feel allergies if you have too much histamine in the body. Well, histamine can increase, like I said, if your adrenal glands are worn down, you're going to get a higher histamine response if your immune system is imbalanced, or if the GI system is misfunctioning. And there's everything we're going to kind of talk about to break all those down. And then also the liver is helping with breaking down histamine, and the liver is also part of the GI system. So I want to address histamine first, because a lot of people talk about like mast cell activation syndrome, MCAS, and they focus really heavily on histamine and dealing with that. And I want to kind of discuss why I don't think the main focus should be on the histamine as much as all of those other causes that I'm going to be getting to. So if too much histamine is released, you're going to have allergies, right? Your mast cells will release histamine, and plenty of other cells in your body will also release histamine in response to allergens, but also in response to any other cellular damage or inflammation in the body. Histamine's effects are actually balanced through the natural release of cortisol, epinephrine, and norepinephrine, like we were talking about before. It's all about balance. Your stress hormones aren't harmful to you unless they're chronically high. If they're at a good normal level, they actually help act as a mediator between your histamine and your inflammation and your anti-inflammation. That's why if someone has anaphylactic shock, you're going to give them an EpiPen, that's epinephrine, because that's going to reduce that inflammation, that's going to allow them to survive. Or if you're not having that, a lot of times you end up with getting a corticosteroid, which is cortisol, which is a steroid that's going to act on the cortisol receptors. However, chronically high stress is going to raise your histamine levels, because eventually the adrenal glands are going to wear out and they're not going to be able to make those stress hormones as efficient. You're not going to have as healthy of a stress response when you need it. Chronic infections like Epstein-Barr virus, or if you've got like Lyme infections, that can also cause histamine to be released. Or if you've got a food allergy, these are all things that are going to increase your inflammation, increase your histamine release. So if you think of it kind of like a bucket with a hole in it, you've got all of these different things filling the bucket up with histamine. Eventually it ends up spilling over. Where if you stop filling the bucket with water, eventually the levels can come down. The other option, which isn't as common, is if you're not metabolizing the histamine, if you're not breaking down the histamine and getting it out of your body efficiently. So you need B9 and B6 are probably the two most important nutrients for breaking down histamine. That being said, if you have chronically high histamine, or you're inflamed all the time, then eventually you're going to have a deficiency in those nutrients, so you're not going to be able to clear it. But think of it like a sinking ship. If you've got holes in your boat, you're not going to be bailing the water out first. You're going to plug the holes first, and then you bail the water out. Then you get rid of the problem. So all that to say, don't focus solely on blocking histamine. Let's fix the deeper problem. So let's start with the adrenal glands. Like I was talking about, the adrenal glands produce a lot of important hormones. They produce aldosterone to help keep you hydrated. They produce testosterone, progesterone, estrogen, but they also produce all the stress hormones, so cortisol, epinephrine, norepinephrine. And those are what's going to counteract the effects of histamine. They're anti-inflammatory. So epinephrine and norepinephrine are adrenaline and noradrenaline. That's what epinephrine will actually inhibit and stop histamine release. And actually, they actually go both ways. So epinephrine can inhibit histamine release, but histamine can inhibit epinephrine. So your adrenal glands are going to be responding to every stress that comes into your body. So whether that's an emotional stress, a chemical stress, so poor diet, if you're going too long without food, if you're constantly exposed to environmental toxin, on and on. Or it could also be physical stresses. So if you've got an injury, if you've got some pain in your body, that's constantly causing your body to release some amount of cortisol or stress hormone in response to that pain. You can also exercise too hard, and that's going to run down your adrenal glands a bit. So if you're not recovering efficiently, if you're not giving yourself enough time to recover, sooner or later your adrenal glands aren't going to be able to keep up with that. So if you're under stress for a long enough time, like I said, you're not going to be able to produce cortisol. And that's when you're going to start feeling allergies, is when your cortisol levels start to drop. That's when your histamine gets to work unopposed. So instead of beating a dead horse until it stops spitting out money, why don't we just keep it alive and healthy so you can make way more money long term? Give yourself a break every now and again. Find what you enjoy, find what fills you with joy rather than stressing you out all the time, and don't sweat the small things. Let's get into the immune system. So, like I was saying, Th2 is what's dealing with your allergy. So if you get a high level of Th2 due to any of those things that we discussed, due to you're constantly being exposed to an allergen, so maybe you're eating a food that you're allergic to, and either you don't know you're allergic to it or you don't care, that's going to make your Th2 cells increase. So, like I said, you got to deal with the high Th2. You got to either stop eating the food allergen. If you don't know what it is, it could be good to try doing an elimination diet. You want to get rid of whatever food you're suspecting to be the allergen for about 6 weeks, 100%, and then see if you feel better. See what symptoms go away. Then reintroduce that food. And if you're going to do multiple at the same time, reintroduce one at a time so you know which one is causing the problem. Give it a couple days, and then reintroduce the next one if it didn't cause new symptoms. That way you can figure out which allergen it is. Or maybe you've got heavy metals, either from like a vaccine, or you've got a mercury filling, or if maybe that's just a workplace hazard for you. If you're working in a place where there's metal shavings, metal being thrown around, and you're breathing that in all the time, then make sure you're wearing the proper equipment so you're not inhaling and absorbing as much metal. Another issue with heavy metals is that's something that's talked about a lot in the holistic community. If you don't have the right minerals to get rid of those metals, then they start building up in the body. So it's definitely important to make sure you're getting good nutrient dense food, then you're getting the minerals that you need to actually get rid of that. I would say zinc and magnesium are two really big ones for several different heavy metals. There's plenty of other minerals that can help deal with it, but those are two of the common ones. Of course, maybe you're allergic to a medication. You can always look up the side effects of whatever medication you're on. You can even find the insert of that medication. So if you search the name of your medication, insert, and PDF, then you can actually find the actual package insert for that so you can see what's the known side effects for your medication. If that lines up, talk with your prescribing doctor. I obviously can't tell you what to do with that, but yeah, take a look at that and see if maybe you just need to change the medication. Of course, it's possible that you also could have a parasite. They're not quite as common as some people will make you think, but it's something to keep in mind, especially if you've got symptoms like you get this random knee pain every 2 weeks. It's like usually a weird cyclical symptom that you can't really explain. Stress, like I said, chill out, find some time to get out in the sun, go to your happy place. Let work get a good stress management strategies, healthy stress management. And then support your T regulatory cells to help bring everything back in balance. Those are the guys telling Th2 to calm down or telling Th1 to calm down when things are getting too far on one side or the other. So you can do that with vitamin A, vitamin D, healthy fats, glutathione, superoxide dismutase. Those are your two big antioxidants. Usually someone either needs glutathione or SOD. They don't usually need both. But and then good amount of sleep, ideally 8 hours, and you should be able to sleep throughout the night without waking up. A lot of people don't, but ideally you're able to do that. And of course, eating a good healthy diet and exercising is going to help improve your immune system. Onto our gut health. So most people with really bad seasonal allergies that I've seen so far typically have some amount of gut complaints, GI complaints, whether that's in their stomach or whether that's like a SIBO or a SIFO. Typically, they have some sort of GI complaint as well. So if you've got undigested food or unsanitized food, meaning you don't have enough stomach acid to kill all the microbes in there, which we'll get to that, then that's going to lead to inflammation in the GI tract, and it's going to lead to leaky gut. Leaky gut's going to allow undigested food particles in your bloodstream, and then your immune system has to clean it up. That's where you end up, if you've done a food sensitivity test and it says you're allergic or sensitive to everything, basically, right? That's why, because you're getting undigested food particles in your body, in your bloodstream. Now your body has to respond to that. So it's typically people have one true food allergy, and it's the most common are what I had on there: the gluten, soy, dairy, nightshades, corn. And then other causes of your leaky gut, if you have a microbiome imbalance, if you've got like a bacterial overgrowth or a fungal overgrowth, those are two most common in the large or small intestine. That's going to be causing a lot of inflammation. You're constantly having an immune response to that. So that's running down your immune system, that's causing more inflammation, that's causing more histamine to be released, filling that bucket to the point where now when pollen's released, it puts you over the edge and you start sneezing all over the place. So clean up your gut. Probiotics often don't fix that problem. Sometimes they can help mask it. It's kind of, I'm stealing this from Dr. Gangemi. Good people don't like to move into a bad neighborhood. You got to get the bad guys out first. So that's in my office, we do that typically with different herbs. So whether that's like Morinda, Malia, Golden Thread, Golden Seal, there's a huge list of them. So side note on that, you shouldn't have a die-off reaction. If you start taking an herb and you're feeling worse, then you're most likely reacting to that herb or you're at too high of a dose for that. So keep that in mind. If you do react to it and you lower the dose and you're still reacting to whatever herb, that's probably not the right herb for you. You should try a different one. Other things, again, don't eat a food you're allergic to. Emotional stress is going to slow down your digestion, which is going to give those bad bacteria and fungus time to grow and get a hold of some land in your gut. And then, of course, if you've got an excessive use of, you're taking too much of the wrong supplement or the wrong medication, that can lead to toxicity and that can throw off your gut as well. So talking about this, going back to the stomach, going back to cleaning your food, sanitizing your food, human stomach acid should be a pH of 1 to 2.5. So that's extremely acidic. This is why a lot of people actually see relief taking things like apple cider vinegar as a natural remedy for allergies, because the stomach acid is what's going to kill all the microbes on the food, or the majority of them. And it's going to start the digestion. It's going to digest your proteins. It's going to trigger your pancreas and your gallbladder to release their digestive enzymes, and the gallbladder release bile so you can efficiently and effectively digest your food, so you don't end up with these undigested food particles where they don't belong. Like I mentioned, if you're not absorbing protein efficiently, If you're not eating enough protein, then your body is going to start taking protein from other tissues like your joints, your ligaments, and possibly your sinuses. If it pulls protein from your sinuses, you can end up with sinusitis that will not respond to most treatments. If it pulls it from the joints, you end up with things like arthritis. If it pulls it from your bursa, you end up with bursitis. So if all of your joints are hurting, especially like you go for a light walk or you do a light workout and all your joints are hurting way more than you feel like they should be, can take a look at how much protein you're eating in a day. It should be 1.5 grams per kilogram of your body weight. So it's usually more than what people think they need. Now onto the gallbladder. Speaking of the stomach telling the gallbladder to release its bile, bile is what you use to digest fat. And if you're not digesting fat, you're not absorbing your fat soluble vitamins. So that's vitamin A, D, E, and K. I'm sure you remember you saw vitamin A and D for your Treg cells. Vitamin E is also anti-inflammatory. So the bile is also a way that the body gets rid of allergens and gets rid of toxins from the body that the liver isn't able to turn water soluble. So the bile is going to carry those toxins through your feces and out the body so they stop causing problems. If you're not efficiently making bile or pushing bile into your digestive tract, then you're not getting rid of those allergens and they get to stay in your bloodstream and keep causing problems. So some ways you can kind of naturally support your gallbladder is by eating foods like beets. You can sip on some lemon juice in some water and eating healthy fats. That helps to actually tell the gallbladder, hey, you need to release bile. So some people like to do you could do beet juice and lemon juice, a little bit of both, mix that together. It's actually pretty good. Talking about the liver now. So the liver also is the thing that makes bile, by the way. So if your liver isn't working well, you're not making bile well, now your gallbladder isn't working well. But the liver is also the thing that's going to detox basically everything in the body. So if you got too much estrogen, too much progesterone, too much testosterone, too much cortisol, all of your hormones is where the liver is going to break those down and get rid of the excess. You got an increase in aldehydes. This is if someone's got high aldehydes, they're going to get hungover. They'll get drunk easier. You'll feel brain foggy. You may even feel hungover or drunk when you haven't drank anything. Those can increase from GI infections. So certain fungus, certain bacteria will actually release aldehydes. Anything with a fragrance in it, that's going to be increasing the amount of aldehyde. So if you're constantly smelling candles or lotions or a lot like any most cleaning products will have fragrances in it. So do your best to get those out of your house as much as you can. It's also found in new car, like the new car smell. Anything with VOCs is going to be releasing some form of aldehydes. So then other environmental toxins like your smoke, your dust, your pollen, that's all going to be things the liver's breaking down. The liver, we all know the liver helps with alcohol. It breaks down medications, cytokines after you've been sick. Take some glycine. That's going to help your liver get rid of those inflammatory cytokines that you don't need once your body's finished fighting off that illness. So if you're 4 days into being sick and you feel like you're a little better, but that cough won't go away, or that achy feeling hasn't gone away, try taking some glycine. That's going to help your liver break down cytokines faster. And then, of course, histamine. So if you don't have that B9, the B6 that we talked about to break down histamine, the liver is the only spot that histamine is broken down. The main organs are the liver and the kidney, though, that break down your histamine. Then, you're going to have a buildup of histamine and your allergies are going to be worse. So if you're not efficiently getting the allergies out of your blood through your liver or through wherever, then you're going to have a buildup of histamine. So what can you do? This all sounds great, but what can I do? So most of us are probably past that first point, but kids who grow up on a farm actually have a 40% reduced rate of seasonal allergies. What this means to me and what we kind of know is getting early exposure to allergens is helping your body and your immune system learn what's dangerous and what's not. Pollen from trees aren't actually dangerous to the body. The dust isn't dangerous, pet dander isn't dangerous, but your body overreacts to these because either it hasn't seen it before, or one of those things that we've talked about is your immune system's imbalanced or whatever. So exercise, good stress management is going to help you balance out your immune system. So like I said, you don't have to go and PR every single workout, but get some good exercise at least 3 days a week, 3 to 5 days a week. Um, and the days that you're not working out, go for a walk, do something light, get some good light movement that helps your lymph flow, that helps your blood flow, that helps your immune system, that usually helps you de-stress a bit if you get some movement in, so that could be your stress management. If you're having a bad day, go for a walk, clear your head, get some fresh air. Of course, a healthy diet. I talk about this all the time because it affects everything in your body. You need to be eating the best food that you can. Ideally, mainly organic. At minimum, go onto EWG's website, look up the Dirty Dozen list of foods, and at least get those foods as organic because those are the foods that are going to hold on to pesticides the most. And then, of course, minimally processed food. So don't eat the ultra processed stuff. If you couldn't make it in your kitchen yourself, it's probably not the best thing for you. Because the more nutrient dense foods that we eat, the less supplements we have to take. And nobody likes needing to keep track of a whole cabinet full of supplements. That being said, a lot of our food quality and the nutrient density of our food has gone down so much that it's very difficult to live and eat in a way where you don't need any supplements ever. If you can, great. Like I talked about before, good quality sleep. So 8 hours. The better time to sleep is actually try to get to bed by like 10 or 11. You'll get better. They've shown that you actually get better sleep during those earlier hours than even if you still get 8 hours going to bed at like midnight. But regardless, if you're getting good quality sleep, that's going to lower your stress, that's going to lower your Th2, that's going to improve your overall health. And eating raw organic honey, local honey, is going to help desensitize you to local pollen in the area, especially the flowers in the area. Alrighty. So like I've talked about, there are so many causes of high histamine. Hopefully this clears up why I think there's way too much focus on histamine. I know I probably said histamine more times today than I have in a last year, but there's a lot of different causes for it. So you really need to look at your stress levels, look at your pain levels, look at your diet. Is there a food that you love eating that you know isn't good for you? Find something else that you enjoy that is better for you. If you like chocolate, go for the darker chocolate. Go for like 80% cacao, and it will start tasting good. If you want to make 80% taste good, try 100% first, and go down to 80, and it'll taste sweet to you after that. But yeah, if you've got a constant nagging pain, take the time to figure out what's going to improve that. Whether that's you need to exercise and strengthen something, or you need to go and see somebody to help clear out the scar tissue or whatever it is. But de-stress, look at your diet, clean up what you can, eat a lot of protein, eat a lot of healthy fats. choose the nutrient dense foods, don't eat your ultra processed foods, avoid the seed oils, avoid food dyes. Those are those have gotten a lot of publicity lately. So I think a lot more people are realizing food dyes aren't good for you. And there's some kids have like ADD, ADHD because of eating food dyes. If they've got an actual allergy to that food dye or sensitivity to it, it can cause those hyperactive type symptoms. And then addressing your immune system imbalances, support your immune system. And part of that is, again, dealing with the stress levels, sleeping well, eating well. So rather than suppressing your immune system if you have an autoimmune condition or if you have terrible allergies, rather than putting that band-aid on it and making your immune system weaker, calm down the side that's being overactive, bring up the side that needs support, so you actually have balance, so you can respond to things in life appropriately. And then heal your gut, avoid your food allergies, eat real food, deal with those infections, work with someone if you want help dealing with the gut infection, if you think you have a gut infection. And while you're dealing with all that, we still want to get rid of these allergies that are happening right now. So like I said, you could try apple cider vinegar. That would be like taking betaine hydrochloride, which betaine hydrochloric acid is what your stomach acid is made of. So betaine hydrochloride is actually going to replace your stomach acid, where apple cider vinegar, that's just increasing the acidity so you can break down the food efficiently. If apple cider vinegar works, betaine hydrochloride probably will work as well. That left side is more so like if you're currently dealing with allergies, those can give you some really good relief. The beta food is concentrated beets. That's a standard process supplement product, a standard process product. Beets are high in trimethylglycine, so it works to thin your bile. And we just talked about the gallbladder. You know why that can be helpful, because then it's like an oil change for your gallbladder, right? So it makes your gallbladder work a little better. Quercetin is anti-inflammatory. It helps stop histamine production, and it has the anti-inflammatory properties. So you can find that in buckwheat extract. Standard processes product is Cyruta Plus. And then Antranex is another standard process product that takes a bovine liver fat extract to help your body detoxify, help your liver detox things. So all three of those are great. Vitamin C is another one. It stops mast cells from breaking down. It stops histamine from being released. But you want to ideally get a whole complex, not just ascorbic acid. So that could be like camu camu is a good natural source of vitamin C. Talked about betaine hydrochloride, vitamin A, zinc, folate, B6. All of those are helping either support your immune system or support stopping histamine breakdown. And that's all I got. So if you want any help with dealing with your allergies, if you don't want to just do the trial and error and do it on your own, if you want to, be able to prioritize what do you need to do to help with your allergies, then there's my website. You can get some more information about me. Feel free to email me, or if you want to even schedule and become a patient, give the office a call and we'll help you out.